Gambian President Adama Barrow received his first dose of the COVID-19 vaccine on Tuesday, March 10, 2021 at the State House. Joined by his vice president and state ministers, the live event is part of efforts to encourage Gambian citizens to take the shots if they can, and most importantly to assure the Gambian people of the safety of the vaccine.
We are here today to launch the Gambia's national vaccination campaign against the COVID-19 pandemic. A year ago, the country officially recorded the first case of COVID-19. At present, the infection rate stands close to 5,000 cases. Hence the restrictions imposed recently. Although most of those infected have recovered, unfortunately, over 150 deaths have been recorded countrywide. The pandemic has crossed all borders and boundaries of gender, age, status, and other characteristics. Like other sectors, not even the frontline defenders in health or the security have been spared. Our national scenario reflects the global situation with loss of loved ones, friends and citizens, both in the country and the diaspora. It is a relief, therefore, that suitable vaccines have been discovered, tested and approved by reliable experts. I am sure all of us wish that the vaccines were discovered earlier to save more lives. Let me reassure you that the World Health Organization, WHO, has confirmed the safety and effectiveness of the vaccine for the prevention and control of COVID-19.
Speaking shortly before being administered the shot, President Barrow said the coronavirus pandemic has impacted all sectors of the economy, taking a toll on virtually everyone. The Gambia receiving 36,000 doses of AstraZeneca through the COVAX facility is something President Barrow said is remarkable, thanking all development partners for making the accessibility of the vaccine possible.
In another development, the World Bank has provided resources to procure up to 40% of the country's vaccine requirement. It will complement the 20% already secured through the COVAX arrangement. The first batch of this lot is available and will be rolled out today. This is a positive step towards realizing my government's urgent and passionate desire for full protection of every citizen against COVID-19.
President Barrow also shared that priority will be given to Gambians who are more susceptible to the virus.
These are the frontline health workers, those aged 65 and above, and people with health conditions.
As the country hopes to receive more vaccines, the Gambian president said plans are already in place to make sure they expand the campaign to other segments of the population.
With the arrival of more vaccines, the campaign will be expanded to include other segments of the population. Meanwhile, the government is working with other partners, such as MRC Gambia and Africa Center for Disease Control, to secure additional doses to meet the estimated national requirement.
Health Minister Dr. Amadou Lamin Samate said while no government had the means to fight the pandemic at their disposal alone, the Gambia government provided the necessary direction and financial support to fight the raging pandemic.
This started with the setting up of the COVID-19 Ministerial Committee that interacted at various levels with the technical and expert committees to give the government the necessary advice that was needed to deal with COVID-19, and these strategies are still ongoing. Numerous interventions, including declarations of state of emergency, closure of the airports, land and sea borders, were declared by the government to help us prevent and contain COVID-19. At this juncture, we thank His Excellency for his leadership in steering the affairs of COVID-19 response in this country, and the Vice President for chairing the COVID-19 Ministerial Committee, and all my colleagues for the long hours that we spent to ensure that decisions were made.
Reassuring the Gambian population about safety concerns and theories that are being peddled by anti-vaxxers, Dr. Samate reiterated that the country will only accept vaccines that are safe and effective.
I must reiterate that the government of the Gambia only accepts vaccines that are safe and effective, and these vaccines have passed the test. The Gambia government, in collaboration with its traditional and development partners, had come together in an unprecedented fashion to support the government in its drive to combat the disease in the country. The entire machinery had been mobilized by the President, as I mentioned earlier, to respond to the COVID-19 pandemic and its ramifications.
Dr. Samate said the availability of the vaccine is a good thing, especially for those who made it through the pandemic, remembering some of the frontline health workers who died from COVID-19 before the vaccine breakthrough.
We pay tribute to all those who lost their lives to COVID-19, including our own healthcare workers. May Allah have mercy on their souls and grant them Al-Jannah. We will forever remember them all. They did not have the opportunity to be vaccinated. Probably if they were vaccinated, they would still have been here with us today. I think this is a big opportunity for some of us, for all of us who are alive today. Your Excellency, as we gather here today to launch the national COVID-19 vaccination exercise, using the first batch of consignment of COVID-19 vaccines, this will mark the beginning of the end of the pandemic globally, inshallah. It is therefore highly significant that all Gambians classified as high-risk groups be vaccinated. I want to take this opportunity to call on every Gambian and those resident in the Gambia, especially those regarded as high-risk groups, to get vaccinated to protect themselves, their families, and the entire population.
Taking the opportunity, Samate once again urged Gambians to ignore the conspiracy theories and infodemic surrounding the virus.
We must close our ears to those few elements amongst us who are spreading false information about COVID-19 and the COVID-19 vaccines and dissuading people from being vaccinated. Because of the seriousness of the disease and its negative consequences, we did see at some point the Holy Haram in Mecca and Medina, as well as the Vatican, temporarily closed. I think this is enough evidence that COVID-19 is a serious pandemic, and all of us need to take it very, very seriously. We want to use the opportunity to inform the population that believing in false information could cost people their precious lives and may end up causing people to lose their loved ones. We shouldn't allow the disease to get an upper ground in this country now that the opportunity is there to get vaccinated.
Sergeant Brito reporting.